the definitive therapy for epistaxis. Goals in the design of Rapid Rhino: eliminate the trauma to the patient upon insertion, reduce time to efficacy, reduction in time for clinical staff, eliminate pain and rebleeds upon removal,
reduce associated cost.
Rapid Rhino combines two proven technologies:
Even gentle compression, tamponade, and active platelet aggregation.
Models available: RR450, 4.5 centimeter anterior; RR550, 5.5 centimeter anterior; RR750, 7.5 centimeter anterior posterior. The 4.5 centimeter size is used for pediatrics and small anatomy. The 5.5 centimeter is the most common size used for most anterior bleeds. The 7.5 centimeter is the longest length, used for even the most challenging posterior bleeds. RR551, 5.5 anterior with airway. RR751, 7.5 centimeter anterior posterior with airway. The breathing tube is ideal for COPD patients. RR552, 5.5 centimeter anterior bilateral. RR752, 7.5 centimeter anterior posterior bilateral. Bilateral design offers simultaneous inflation, ideal for counterpacking in epistaxis. When counterpacking is needed, we have bilateral models in both anterior and posterior sizes available with or without airway. RR530, 5.5 centimeter anterior non-inflatable. The RR530 or Rapid Pack uses no inflation and is ideal for mild anterior bleeds in place of nasal tampons or cold cautery. Rapid Rhino components. The device components are medical-grade PVC, and the fabric is a proprietary
carboxymethylcellulose.
Rapid Rhino packaging, individual sterile units, the shelf box, the tackle box.
And we're here to discuss the application and insertion of the Rapid Rhino for control of epistaxis. So the first thing you'll note about the Rapid Rhino is that it has a very low profile and it's extremely malleable. Upon taking the device out of the sterile package, you soak it in water, remember, not saline water, for at least 30 to 45 seconds.
It is extremely important that the device is soaked in sterile or distilled water, no saline, for at least 30 to 45 seconds prior to insertion. The use of saline will inhibit the fabric's ability to convert into a hydrocolloid gel. If not totally hydrated, the fabric will restrict proper expansion during inflation, therefore giving a false indication of pressure. When saturated, the fabric converts into a slippery hydrocolloid gel, allowing for an atraumatic insertion, as well as allowing the fabric to fully expand when inflated.
This converts the hydrocolloid material into a self-lubricating gel. That gel is a hemostatic material and it works by way of active platelet aggregation. The low profile and malleability of the Rapid Rhino will allow the highly lubricious surface to be easily inserted without trauma to the patient. This is especially beneficial if your patient has a deviated septum or a bone spur. You then insert the device along the nasal septal floor, ensure that the fabric ring is within the nares. This will allow the inflatable cuff to properly unfurl. Once the device is properly within the nasal chamber, inflate with air only. Now the device works on the same principle as an ET tube, high volume, low pressure. You'll note that the device has a pilot cuff in order to determine the direct tactile feedback as the device is being inflated. The key parameter is pressure, not volume. The device works in minutes. After initial placement and inflation, you may notice that within 15 to 20 minutes the device may seem loose, as if it was deflating. It is not deflating at all. What has occurred is that initially the turbinates are inflamed or swollen due to the bleeding. When the bleeding has been arrested, the turbinates go back to their normal state. Therefore, there is a space or a feeling of looseness. If this occurs, simply add a little more air prior to discharging the patient.
It is important, prior to discharging the patient, recheck to ensure pilot cuff is still firm. Add air as needed.
If you put the device in tonight, tomorrow morning take it out. It works that fast.
Initially, you may want to leave the device in for a longer period, for 2 or 3 days. Many doctors have proven to themselves using the following. First time they use the Rapid Rhino, they will leave it in for 3 days. The next time, they will leave it in for 2 days, until they are comfortable in leaving the Rapid Rhino in just overnight.
And finally, it's important that you tape the device to the patient's cheek as an added safety precaution. You okay?
To prevent distal migration, it is imperative to tape the Rapid Rhino inflation port to the patient's cheek.
Another great thing about Rapid Rhino is removal is just as easy as insertion. Simply deflate. Remove. You'll notice there's no dislodgement of the clot because of the lubricious surface of the product. We've been using Rapid Rhino at my hospital for years, ever since the product was first introduced. I found it's probably the fastest, easiest way to control epistaxis. It's perhaps the best time saver that we've had in the emergency department. Very little preparation, it's easily inserted. The safety and efficacy is just superb. The patient tolerates it obviously very well. It works on patients with low platelet counts, patients who are anticoagulated, nasal fractures, posterior bleeds, anterior bleeds. As far as I'm concerned, this is the best thing that's ever happened to the treatment of epistaxis in emergency medicine.
Frequently asked questions. Can I lubricate the fabric with KY jelly or an antibiotic cream before insertion? No. The hydrocolloid fabric converts
into a highly lubricious surface
that eases patient discomfort during insertion, thus making lubricants unnecessary. Furthermore, using lubricants or creams may inhibit the active platelet aggregator's ability to actively produce the cascade of events that lead to the total control of bleeding. What is the active platelet aggregator?
carboxymethylcellulose.
What is the inflation rate? Since every nasal chamber is going to be slightly different, the amount of air needed to achieve a firm, rounded cuff will vary from patient to patient. The pilot cuff gives you direct tactile feedback, so you can assess proper pressure. Keep in mind the critical parameter during inflation is pressure, not volume.
Does it work like Surgicel?
Both are platelet aggregators,
But Surgicel was designed
to attach to an anastomotic site. Rapid Rhino, however, will not adhere to the wound site and, more importantly, will not disengage the newly formed clot when removed.